This week marks the anniversary of major changes across Michigan. The COVID-19 pandemic started 5 years ago, and the fallout from it continues.
There have been major challenges, but also advancements, especially in the world of healthcare. TV5's Zane O'Mara spoke with a doctor about what's changed. Zane.
The doctor I spoke with today tells me he and others were monitoring the virus initially while it was still in China, but the first case was reported here in Michigan on March 10th, one day before it was declared a pandemic.
I still have vivid memories of a patient that I saw the last day we were seeing patients live and in person that had 102-degree temperature and myalgias and all kinds of things, and I'm thinking, oh boy, could this guy have COVID? It's definitely kind of a terrifying feeling when you think about you have people in here that might have a potentially fatal virus.
It's been nearly half a decade since COVID-19 was declared a pandemic by the World Health Organization, shutting down businesses, schools, and life as we knew it. But for healthcare professionals,
this is awful, but we had to talk about refrigerated trucks because our morgues were full in one of our subs.
Brad Ropp is the chief medical officer at McLaren Medical Group. He says in Michigan, Detroit was hit the hardest first.
Certainly was concerned just because there's a lot about COVID we just didn't know or understand. We just knew that it had a lot more fatalities associated with it than other viruses.
The virus forcing medical providers to switch to virtual appointments and limit who could come into their facilities.
We changed our protocols pretty much on a dime and went to a totally virtual platform within a couple of days. Which was a huge undertaking, but and then we just figured out as we went, tried to make sure we used what limited resources we had to the patients that we could help the most.
Since then, restrictions have relaxed, but hospitals like McLaren have integrated some COVID protocols into their routine.
I think there's no question that the virtual options, that is clearly something that has improved and gives our patients a lot more choice of what they can do online with their health care. And I see that expanding even more.
And while COVID deaths have gone down, and Ropp says the virus has become more like the flu, he tells me it is still a very real and contagious illness.
Frankly, if people would make sure they think not just about themselves, but others around them when they're thinking about, the vaccine pieces and other things, because you may be saving somebody else's life by actually getting the shot.
And 5 years later, healthcare professionals are still facing challenges from the pandemic today.
There is a lot of underlying anxiety, and I find that our teams are dealing more and more with difficult patients that can create challenging situations for them in the office and hospital settings, more than we did pre-2020. And I almost feel like that's a residual from the aloneness, for lack of a better way of putting it, from the pandemic. But I do feel like we've now been through one before. God forbid we ever get a second, but I feel like that we can learn and have learned from this event so that we wouldn't make some of the same mistakes twice.
Ropp tells me he's thankful for all of the first responders on the front lines and their response during the pandemic. Michigan no longer updates the cases and deaths on its website, but from its last update about a year ago, more than 44,000 people had died from the virus throughout the state.